How are you? I ran this and I got these guys over here, so if you don't laugh at me, I don't give a fuck. For those of you guys who don't know me, my name is Dr. Mehta. I do practice in Flemington. I might not after this show. I'll keep it going. I want to say one thing right off the bat. My job is hard. It is. And I'm not trying to get a lot of favoritism. I'm not trying to get people to rub my back and say it's going to be okay. It's just hard. And I know it's hard because I have parents who are doctors. And I watched the evolution of medicine, and I've seen them practice medicine, and I see me practice medicine, and I see it's different. And it's not that medicine is changing, it's that people are changing. You all are people. And you all are changing. It's not that you're changing because you're bad, it's because you have more demands. Because you have more things that you want to take care of, because you know more information. And that's no fault. That's just the world we live in. My father and my mother, I used to go to work with both of them sometimes, and my father, he was a very stern man. He used to see a lot of patients. Lady would come in and say, "Dr. Mehta, I'm deaf, I can't hear anything, I'm deaf, I'm deaf." "Shut up and sit here. Sit down. You're scaring all the patients." She'd look in the ears, find out there's a lot of wax in there, rinse them out, she can hear again. She was very thankful. She said, "Thank you, doctor." "Okay, get out of here." Now, he didn't have very good bedside manners, but he got a lot of respect, because that's what he did. My mother, she worked in a psychiatric hospital. She worked in a psychiatric hospital. I want to say that. Everyone used to see me in my neighborhood. I know she worked in the psych center. To get that shit straight, please. But she worked in the psych center. I remember there was this guy, Larry. He was kind of crazy. One time, Larry got on the side of, got on top of a chair, held a plastic knife to everybody, and said he was going to kill all you fools. My little mom, she was a 5-foot little Indian woman. "Let it get down, please." There's none of these people talk to you. "Let it come. Don't worry, come on. Looks like your blood pressure's up again. We'll take care of it, don't worry. Come on. And he would get down, because he respected her. He respected what she said. He killed all those fools later, but he got down. You know, and that's what medicine changed. The respect has changed. People got a lot more demands, and I can't change that. We just have to accommodate for that. So we all know we had a snowstorm the other day. We know it came down. People were shoveling. Of course, people shoveled. They break their back. They hurt their back. Now I had a lady who came in. She said she needed to see me, so she comes walking in. It's always the dramatic people that come walking in that you know really don't have that bad an issue, but they want to make it known that they're there for a reason, okay? And they know what they want, because they got it in their mind. So she walks in. Man, let me give you a I need a wheelchair. She finally gets in the room. Before I can even step in the room, she tells me, "Dr. Mehta, I need an MRI and heavy pain pills." I don't need anything else. I need pain pills and an MRI now. And I said, "Well, that's all good, but since you shoved your ass out of the driveway and I got dressed up and drove through a snowstorm to be here, let's play this shit out." So I said, "All right." And I get her history, and she tells me she's shoveling and her back hurts, and I understand that. So I said, "Why don't you come sit on the exam table?" This lady skip, jump right, bam, right on the exam table. Now, herniated disc and all, I looked at her and I said, "I don't think we're going to need an MRI. She's like, "Why don't you listen to what I want? My last doctor gave me everything I wanted. You don't give me anything, you don't care." It's not that I don't care. It's that we don't need it. You know, and I'm not a robot. Okay, MRI, must give here. You know, I don't do that. I just know there's a reason for everything. You don't need to do some things. And it doesn't end there. I mean, even when I leave the office, I had telephone calls. Because I get telephone calls because people who don't get to go to the office get to call me at all times of night. And tell me what the problem is because they didn't get to make it to the office. They get to tell me on the phone. Now, I'm okay if little Johnny has a fever and he's running a little temperature, your blood pressure's up a little bit. I'm okay with answering those questions. Those are legitimate questions. But when I get calls about, "Hey, I just took Tylenol. I wondered, is it okay if I take Advil?" Yes, I think it's okay. Now, I maintained my composure, but I was like, yeah, that's a stupid fucking question. But all right. You know, 3 a.m. in the morning, somebody calls me, Dr. Mehta, I can't sleep. Oh shit. Go bigger. 3 a.m. I was wondering if you could call me in some sleeping pills. You know what? I'll meet you at the fucking store because I wouldn't have to call my shit in too. You know, people don't think about the other person on the other line. That's a human too. I'm a human. It's a brown one, but it's still fucking human. Alright? The best thing I think is when Sandy hit us, and Sandy knocked the power out. At least I lost power. I'm pretty sure everybody else did. And I had a hell of a day. And I'm lying in bed looking at my own breath. The dog's in about 5 layers of blankets on the ground. And the phone rings. A lady says, Dr. Mehta, I'm cold. And I said, ma'am, I know exactly what you're going through. I'm cold my damn self. She's like, no, I have power and everything. I'm not that kind of cold. I'm just that cold when you go from outside back to inside, and you're like, burr. I wanted to kill this guy. Because as I'm seeing my breath coming out of the phone, I tell her, warm up some milk, light a fireplace, go ahead and tell the story to your little boy, and enjoy that warmth. You're going to be going to sleep anytime soon. Trust me. But then, you know, people come in for crazy stuff too. We had the snowstorm the other day. And we as staff had to come in to help the sick and the needy. The sick and the needy people. So this guy comes in and said, I need to come in. It's a personal matter. I need to come in. Staff's like, are you sure? It's kind of pretty bad out. It's like blizzard-like conditions. I don't think you can do that. No, I'm going to come in. It's a personal issue. So I sit down. The nurse goes in, checks the guy in. The nurse says, what are you here for? He's like, with a grimy, creepy face, the nurse got up. She's like, there's a live one in here. Let's see this shit, get him out of here. Now, I understand when you need to come in and everything, and you have issues, but really? Because your Slim Jim didn't work, you had to come in the damn snowstorm to get it to work? Can't play a board game or something? Watch TV? Watch a damn movie? You gotta come in? He comes in 2 days later during the next snowstorm to get a refill. Doesn't stop. But anyway, let's do it next time. Who's got neck pain here? Who? Everyone, come on. There, you. There, you got neck pain? Yes. Okay. I want you to do something. I want you to sit up straight in your chair, just like you are. Good. Good. Put your right hand, all right? Put your hand behind your neck like this. Okay? Then with your left, I want you to take your index finger to your left and hold that elbow right there. Hold it. Like touch it. Yeah. Stay there. Do you feel anything? No, because I'm fucking with you. But I like that because she respected what I was trying to do. You know what I'm saying? That makes you feel very special. Thank you for being something. Don't sue my ass or nothing. Don't watch it on TV like, do you get fucked at the Doctor's Comedy Show? Just like you need a settlement. 888. But that's special because see, I have people that don't listen to me. My wife is someone who doesn't listen. Okay, I don't sleep on the couch, I don't give a fuck. But my wife always seems to have a problem. She always seems to feel that comfort when if she has a doctor as a husband, she's going to be able to ask him whatever the fuck is wrong. This morning's different. My hair's changing. My neck hurts. My back hurts. My belly hurts. Everything fucking hurts. Do something. So, one time her belly hurt. And I said, okay, what's happening? I said, I don't know, I ate something. I don't feel right. I said, all right, let me touch it. Don't touch it. Don't touch it. Okay. I said, well, I gotta touch it. I gotta see what's going on. I want you to touch it. It's gonna hurt if you touch it. I said, all right, why don't you try to drink some water? Drink some ginger ale. Ginger ale's good. Ginger ale calms it down. I don't like ginger ale. It's nasty. I don't like that. Why don't you take some Advil if it hurts? Take some Tylenol. Make it feel better. Make the pain go away. I don't want to do that. I don't want to take anything. Just leave me alone. One lion is coming. lie in your stomach, take some pressure off, lie in your stomach, you'll feel better. I don't want to do that. So I said, all right. 15 minutes goes by. She drinks some water, takes some towel, lies on her stomach, she's fucking feeling better. What does that tell you? I don't want to listen. But Dad there, Dad fucking listen. Thank you, Dad. That's an all-star right there. Now, I do have patients that do make me feel good. I do have some patients. I got people in Hunterdon that are special because there's people who come from, I don't even know where they come from, man. They come from some farm out there, and they come into a doctor's office, and it's like the first time they were there. And so I tell this guy, I said, listen, I want you to get into this gown, I want you to take everything off, and we're gonna get started. And so he said, okay. So he got into the gown, he's butt naked, he goes out in the hallway. He goes, what you want me to do now? Butt naked, he's just sitting there. So why don't you go back in the room, we'll get this party started in a second. So I got a history of doing everything. And I always end the exam, the prostate exam. I ended with the prostate. I just don't think it's nice to stick a finger up someone's ass in the beginning of an appointment. It's not the best way to meet somebody, so I always try to wait till the end, try to smooth things out, get them to know me, and then close the date off nice. You know what I mean? So I ended with the prostate exam, and the guy's bent over on the table. I said, all right, this is what we're going to do, just bear with me, and I finished. And he said, man, I'm sure glad you can speak English. I said, what is that supposed to mean? He said, well, I had an Indian doctor before, I couldn't understand what he said. I said, what is... He said, you need to bend over, I got to do prostate. I said, excuse me? He said, bend over, sir, I need to do prostate. I said, I don't understand the words you're saying. Boy, that boy bent me down, put me on that exam table, put that finger up there, boom, boom, I know my prostate was dead black. Never hit that prostate again. Another guy actually came in, this was just recently, and I liked what this guy said. This guy tells me, you ever go out and you're just maybe at a mall or at the grocery store, and someone just gives you a hug out of nowhere, and you're like, who the fuck is this motherfucker? But he hugs you, and he's like, hey man, it's so nice to see you again. I got so much to tell you. I can't wait to catch up. I was like, I don't even know who you are, but at least now I got a computer screen to figure this out. So I see this guy, I might have seen him 2 or 3 years ago, I can't remember, I don't remember. I see a lot of people, they're all white, they're like you. So I see him and he comes in, and he's a little overweight. And I was like, hey, man, what are you doing about your weight? What are you trying to do to get this weight down? And he said, I play tennis. I said, oh, I play tennis too. It's one of the few sports Indians play and we're pretty good at. And he's like, oh, wow, really? You play tennis? I said, yeah. He said, you should come to Beers and Balls. I don't really know. I don't really know what Beers and Balls. I don't really tennis team or something because I just used to play with the balls. You know what I mean? He said, no, man, we play doubles. I said, I still don't think this is a game I like to participate in. And he said, no, beers and balls. What happens is, one group brings a beer, the other group brings the balls, we play tennis, then we wait afterwards and we drink beer. And he said, oh, okay, so let me get this right. You play tennis, you lose some weight, you burn calories, then you finish, and then you drink beer, and then you get drunk, and then you go home and get calories back. He said, yeah, I think I know what's going on with your weight. But I mean, another thing is computers. We gotta type on fucking computers now. Everything is typed on the computer. Your whole damn history is on the computer. We gotta be a damn court reporter in the room, typing your history. Oh, what happened? Oh, you fell? Oh, what happened? In 3rd grade, you did this? What? You got a splenectomy? Oh, okay. Oh, ear infection. But your ear's off. You can't hear? What? Yeah, what? And you gotta talk, and you gotta explain everything, and you gotta type this up. And I'm looking at jobs at U.S. News and World Report, and it said 8th best job as a doctor. 8th. Do you know what's 3rd? A computer analyst. Fucking computer analyst got me. Why didn't I just become that? I'd have less loans. I'd have less school. I'd have a lot more youth. So I said, all right, let me try a different job. So that's why I wore this outfit right here. I went to a gas station. I said, why not? I said, I know a couple uncles out there who do this shit. So I said, okay. Guy comes up. Hey, sir, how are you? Yeah, good, man. What are you on? 95. Oh, premium. Oh, premium gas for a premium guy. Oh, good. Yeah, right. Nice car, man. Oh, me? No, I drive the Honda there. Yeah, Honda, my whole family is in there. My grandma's in there now. Yeah, don't worry. Yeah, nice suit. What do you do? Businessman. I'll tell you what. You go inside, here's a coupon. Go talk to my friend Raju, get a free donut in there. Oh, you want to tip me $5? For what? Being a nice brown guy? He listens to your problems? Tells you how nice you look? Gives you advice? Oh, what are you doing? You want a donut? You're worried about your cholesterol, your diabetes. Don't worry. My friend here, Dr. Mehta, will take care of you. Oh no, don't worry. He loves hearing about how shitty your life is. Yeah, man, go straight. You're taking. Or you don't need an appointment. Tell him I sent you. Thank you, everybody.